Hi, I'm Donna Dorozinsky, founder and CEO of Just in Time GCP, as well as the lead editor for Barnett's GCP, a question and answer guide. I'm here today with Keith Dorricott, who is founder of Dorricott Metrics and Process Improvement Limited. And super excited to have you join me today, Keith, as one of our chapter authors for the chapter on risk-based quality management. I have some questions I was hoping I might share with you.
Absolutely. Great to be here. Thanks, Donna.
So let's talk a little bit about the highlights of your chapter. I really enjoyed reading it, and I'd love for you to share with our audience just some of the highlights that you shared in the book.
Well, I think probably the first thing to say is that it's a completely new chapter in this revision of the guide. So we didn't have this chapter before. So it was, in some ways it was nice. It was very different to sort of editing an existing chapter. I was able to go in and say, right, well, what would I want to know if I was starting afresh now? I knew nothing about it. What are the sorts of questions I would have, and what would I want to know? So I guess that's probably the first thing to say. It's all with all the various companies I do, consulting with and I work with, and then the consortia I work with, I've sort of tried to pull out the various challenges that I know come up again and again and again, those questions that people keep asking, and to try and sort of distill those down, and then pull in the sort of quotes from the various regulations, including which we may want to talk about a little bit more later, about E6R3, the draft, and sort of building in, what is the current state of knowledge, and against the various questions that everybody seems to ask at some stage.
So what have you found to be some of the challenges RBQM approach?
Well, I think the even just the terminology people struggle with. What is the difference between quality by design and risk-based quality management, and what's risk-based monitoring and versus risk-based quality management, and so on and so on and so on. And it is tricky because the terminology changes over time. It's not as if there's a settled terminology, I think, yet in the industry. So it's still, even though it came out in the 2016 E6R2, it's still relatively new to the industry. So I think the industry is still sort of finding its way and sort of settling into what is the right language, what's the sort of basic approach that we should use, and so on. So I think those are some of the challenges that organizations that are new to this really have. And of course, because in our industry people move around so much, don't they? You find then, well, if you've got all these differences in terminology and methodology and so on, then it gets quite confusing in organizations that, one person's trying to do it one way, maybe someone's brought something in from outside that's very different, and so on. So all those sorts of challenges, I think, are there. And I think what I've tried to do in the chapter is sort of distill it down to, well, what really matters, what's it actually all about, and therefore what's the way to go forward. Some of the detail of it, how you do it in the detail, may not be that important, but it does matter that you understand why you're doing it. Why are the regulators telling us to do this? Why is it so important?
So I think a little bit about RBQM is that it's really about creating a culture of quality, right? Like that's really the basis of this. So for some of our listeners who are out there who are struggling with how to take that first step in their organization to making it not just about words of RBQM or risk-based monitoring, but what are some things that they might be able to do or bring into their organization that could help them start to get on the path of compliance, right? Because we know that inspectors are going to start inspecting to this concept of RBQM. So what are some first steps that companies could take?
Well, that's a great question. The first thing, I suppose, is, you should be doing risk assessments. So for your clinical trials, you should be doing risk assessments. And there's freely available tools out there to help with risk assessments. So risk assessment, number one, but of course you've got to do something with your risk assessment. The whole point of a risk assessment is you determine what are the highest risks, and then you do something about those high risks. And I'm always telling my clients, you've got to be able to tell the story, because that's absolutely key. You find, I talk with clients and they say, oh, well, we did this. I said, well, why did you do that? you've got to be able to explain, you identified this risk, and then you decided this risk was a high risk, and so you took this action. Who took the action? Was it effective? And so just be able to tell the story, because that's what you're going to need to do in front of an inspector. So I think those, certainly there's some first steps that organizations could take there. But the cultural part that you mentioned is also so important. Is how do we encourage people to think critically, to question, not just to sort of accept the status quo always, and to challenge perhaps the complexity of some of the protocols. We're constantly hearing about protocols are becoming more and more complex, and there's all sorts of justified reasons as to why that might be, but not all of it's justified. Do we really need all of the complexities that we add to our protocols? Because that in itself can lead to problems with from a quality perspective. So how can we sort of try and build that quality in, make it work right the first time, and be proactive rather than reactive as far as quality is concerned?
I love those. I think those are great tips. One of the things that you got me thinking about, as you know, I'm a little bit passionate about trial master file and TMF. And so
Yeah.
what was happening in my brain is, well, how do we document all of this? And maybe a tip for our listeners in terms of what are some records that they would be generating as part of this RBQM that an inspector might actually ask about?
Well, I mean, the risk assessment, absolutely. I mean, we hear that the MHRA, that's one of the first things they'll ask for when they do an inspection. They'll say, well, show me the risk assessment. And when you think about it, that's a perfectly reasonable thing for them to be asking, because it tells them so much about how you're managing the trial from a quality perspective. Remember, we're focused here on the participants' safety, rights, well-being, and on data reliability and integrity. These are the things that are so important, and of course they're so important to the regulators. So that's what we focused, and we should be focusing the risk assessment on. And so by looking at the risk assessment, that must be properly documented and in the TMF, and the various reviews of it properly documented, and so on. That's, if I was an inspector, that's certainly where I would start. I mean, it makes so much sense, because so much should follow through based on the risks that are identified and how you then tackled and manage those risks, as well as, I suppose, issues as they come up within a study, of course. So as issues come up, when maybe some of which may be very serious, how does that link back to your risk assessment? Were they things that you'd already identified as possible risks and were managing as risks and became issues, or was it something that just was not even anticipated? And if it wasn't anticipated, well, what's the learning from that? Are you making a change in your process because things were missed that perhaps could be missed in the future?
I think the point you make about a regulator asking for that risk assessment, it almost creates a roadmap for them, right? They request that risk assessment, and then they know where to start to look to see, okay, well, this is what you said was going to be a risk. Let me see the data that you looked at it, right?
Absolutely.
And so that data, that documentation that they looked at, that is kind of the next piece of it, right? So that they give evidence that they did what they said they were going to do.
That's right. And any actions, if you've identified risks, you've identified actions are going to be taken to try and reduce the risk, to better control that risk. Well, were those actions taken? How do you know they were taken? Where's the evidence that they were taken? And did it affect the risk in any way? Do we know that? Is there any evidence? I mean, for those high risk items, and as I say, it's participants and data we're focused on here. So it is the most critical sort of thing within a clinical trial, really.
So you mentioned ICHE 6 a few minutes ago. We have R3, right? We have Annex 1 draft, and now we have Annex 2 draft, and we're hoping any day now to get Annex 1 finalized. But what are some things that you see organizations thinking about in terms of the new information that came out of Annex 2, and as they plan for the finalization of Annex 1?
Yeah, so with Annex 1, at least, there's the draft. Of course, we're both of them draft, aren't they, at the moment as we speak? But with Annex 1, the difference is actually the sort of the quality management piece, as it's called within E6, are relatively small. I mean, you could argue some of them could be of some impact, but I don't think, certainly overall, the overall approach is no different. It's all about starting with what's critical, identifying risk, controlling risk, and so on. So it isn't hugely different. We've got some slightly different terminology of acceptable ranges versus quality tolerance limits, and a few sort of bits and pieces like that. But at least in the draft, it doesn't look as though it's going to have a huge effect in terms of that particular part, that quality management piece. But of course, what we do see in the draft of Annex 1 is we see much more all the way through the whole document, much more about risk-based approaches. In fact, I was only looking the other day. Why would I do this? I don't know. I was only looking the other day. That's how many times the word risk comes up in the revised version, the R3, the draft, and it's I believe 74 versus 37. It's literally double versus 37 in R2. So risk-based approaches are absolutely here to stay, and the regulators are pushing and pushing and pushing. So you can't ignore it. If you've ignored it up to now, you absolutely will not be able to ignore it anymore. So that's Annex 1. Annex 2, I guess there's that's all to do with, I suppose, sort of new design trials and the opportunities of decentralized clinical trials and so on. And I think in terms of quality management, all the same principles apply. So in a sense, for quality management, I don't think it makes a lot of difference. It shouldn't do, but it's and I've had lots of discussion with people at decentralized clinical trials and RBQM, and actually RBQM is perfectly set up to manage all of these sorts of things, because it's about what are the risks, and you've got to think then what are the risks for that particular trial. And of course, if you've got you're using a completely new technology, well, there's certain risks that you're going to be considering there that you wouldn't consider if it was a technology you've been using for many, many years and is established. So the risk-based approach works regardless, actually.
It's almost like just going back to the basics, right? If you go back to the basics, you set yourself up for success.
That's it. And I think it's so important because people, that's the fundamental thing. People need to understand why they're doing it. Why are the regulators saying this, and get back to those first principles, and then it will work. It will make sense then.
Right.
Yeah.
So maybe your final thoughts. So I don't know about you, but I'm starting to think about the next version, the next book. What are some things that you would want to make sure you're including in your future chapter, next time around? What are just what's some tidbits of new information?
Well, I think it looks as though we're going to see some, more swirl debate in the industry around quality tolerance limits, key risk indicators, and acceptable ranges, all those sort of measurements of risk. So it's going to be interesting to see where that goes in the industry. It's still, it's going to swirl around once E6R2 Annex 1 is finalized, at least. So it'll be interesting to see where that moves, and we'll be able to have some updates around that, I'm sure. And then I think another area is actually critical to quality factors, because that's, critical to quality factors are in E8R1, so it's already out there, but in E6R2, it doesn't even mention critical to quality factors. It talks about critical data and critical processes. So it looks as though Annex 1 of E6R3 is going to use that same terminology of critical to quality factors. And so now the question is, well, then what does that really mean? How do we implement that? What is a critical to quality factor really? And there's not a lot of guidance out there about what that is, because it's easy to say, well, tell us what's critical about the trial, but what does that really look like? And I think some of those practical aspects, which is what I've tried to bring into that section of the book anyway, I think that's going to be another challenging area for organizations once E6R3 is actually finalized.
So maybe one last question that kind of came out of what you just said, and that's, do you think there's an opportunity to start to do some industry standardization for the things that we look at that yes, every trial is different, but to some degree, even within organizations, there's consistent risk. Do you think we have an opportunity downstream to start looking at creating some risk standards?
Oh, we so do. I mean, I completely agree with that. We absolutely do. I was leading a panel actually at Scope Europe on the challenges between working with between sponsors and CROs. And if you look at it from a CRO perspective, you know, working across multiple different sponsors, everyone has their different approach. I mean, it's just sort of mind-boggling
Yes.
how they manage with it. And you know, when we think, what is this ultimately? What is this about? It's about quality. It's about, you know, those participants' rights, safety, well-being, and the data integrity. These are the things that are important. But if we make things so complicated and so many differences that really aren't, most of them probably aren't actually that important, then we've got much more opportunity to have things to go wrong. We just make it too complex for people. So standardizing and just putting some guide rails really around, you know, what is acceptable or what is reasonable and what actually is just doesn't add value, I think would be of huge benefit to the industry.
Well, it sounds like we have a topic for our next interview, right? Let's talk about some opportunities for standardization. Keith, I want to thank you so much for joining me today. I could listen to you talk for hours. So wishing you a great holiday and thanks so much.
Thank you.